AIDS, or acquired immunodeficiency syndrome, is a serious condition caused by the human immunodeficiency virus, or HIV. This virus specifically targets the immune system, which is the body's defense mechanism against infections and diseases. When HIV enters the body, it begins to attack and destroy crucial cells in the immune system, particularly the CD4 cells, also known as T cells. Over time, as the number of these cells decreases, the body's ability to fight off infections and certain cancers diminishes significantly. HIV attacks the body's immune system, making it difficult to fight off infections and diseases. This leaves individuals vulnerable to a wide range of illnesses that a healthy immune system would typically be able to fend off. Without treatment, HIV can progress to AIDS, the final and most severe stage of the infection, where the immune system is severely damaged. Arthritis, on the other hand, is a term used to describe inflammation of the joints. This condition can affect one or multiple joints and is characterized by pain, swelling, and stiffness. There are over 100 different types of arthritis, with the most common being osteoarthritis and rheumatoid arthritis. Osteoarthritis is a degenerative joint disease that occurs when the cartilage that cushions the ends of the bones wears down over time. Rheumatoid arthritis, however, is an autoimmune disorder where the immune system mistakenly attacks the joints, causing inflammation and pain. It can cause pain, stiffness, and swelling in the joints, making it hard to move comfortably. These symptoms can vary in severity and may come and go. In some cases, arthritis can lead to chronic pain and disability, significantly impacting a person's quality of life. Early diagnosis and treatment are crucial in managing the symptoms and preventing further joint damage. While AIDS and arthritis are different conditions, they can sometimes be related. People with AIDS have a compromised immune system, which can make them more susceptible to various infections and conditions, including different forms of arthritis. The relationship between these two conditions is complex and can be influenced by several factors, including the individual's overall health, the presence of other infections, and the specific medications they are taking. People with AIDS can sometimes develop arthritis as a complication of their weakened immune system. This can occur because the immune system's inability to function properly makes it easier for infections to take hold, some of which can lead to arthritis. Additionally, the chronic inflammation associated with HIV can also contribute to joint problems. This can happen because HIV can make it easier for the body to develop infections that can lead to arthritis. Opportunistic infections, which are infections that occur more frequently and are more severe in individuals with weakened immune systems, can trigger arthritis symptoms. These infections can cause direct joint damage or provoke an inflammatory response that affects the joints. In some cases, certain medications used to treat HIV can also cause joint pain as a side effect. Antiretroviral therapy, ART, which is the standard treatment for HIV, has been highly effective in managing the virus and improving the quality of life for those infected. However, some of these medications can have side effects, including joint pain and muscle aches. It's important for patients to communicate with their healthcare providers about any side effects they experience, as adjustments to their treatment regimen may be necessary. It's important to remember that experiencing joint pain doesn't automatically mean you have AIDS or arthritis. Joint pain can be caused by a variety of factors, including injuries, overuse, and other medical conditions. However, persistent or severe joint pain should not be ignored, as it may indicate an underlying health issue that requires medical attention. However, if you're experiencing persistent joint pain, it's essential to see a doctor to determine the underlying cause and receive appropriate treatment. Early intervention can help manage symptoms, prevent further joint damage, and improve overall quality of life. Whether the pain is related to arthritis, HIV, or another condition, a healthcare provider can offer guidance and support in developing an effective treatment plan. The connection between AIDS and arthritis is complex. HIV weakens the immune system, making the body vulnerable to opportunistic infections. These infections can sometimes target the joints, leading to inflammatory arthritis. Additionally, some medications used to treat HIV can have side effects that affect the joints. This increased susceptibility to infections is a key factor linking AIDS to arthritis. Furthermore, HIV itself can directly or indirectly trigger inflammatory responses in the body, potentially contributing to the development or worsening of arthritis in some individuals with AIDS. Diagnosing AIDS involves a blood test that checks for the presence of HIV antibodies. These antibodies are proteins produced by the immune system in response to the virus. The initial test is usually a screening test which is highly sensitive and can detect even small amounts of antibodies in the blood. If the screening test is positive, it is followed by a confirmatory test to ensure the accuracy of the diagnosis. This two-step process helps to eliminate false positives and provides a reliable diagnosis. These antibodies are produced by the body in response to HIV infection. The confirmatory test is often a Western blot or an immunofluorescence assay, which are more specific and can differentiate between HIV antibodies and other proteins that might cause a false positive result. If the test detects HIV antibodies, a follow-up test is done to confirm the diagnosis. This follow-up test is crucial because it ensures that the initial positive result was not a mistake. This is crucial for determining if the individual has HIV infection, which can lead to AIDS if left untreated. Early detection allows for timely intervention, which can significantly improve the quality of life and health outcomes for the individual. Early diagnosis of HIV is essential for starting treatment and preventing the progression to AIDS. Antiretroviral therapy, ART, is the standard treatment for HIV, and it works by reducing the viral load in the body to undetectable levels. This not only helps in managing the disease but also reduces the risk of transmission to others. It's important to note that it can take several weeks after infection for the body to produce enough antibodies for the test to detect. This period is known as the window period, and during this time an individual might have a negative test result despite being infected. Therefore, getting tested regularly is crucial, especially after potential exposure to HIV. Regular testing ensures that if someone is infected, they can start treatment as soon as possible, which is vital for their health and for preventing the spread of the virus to others. The symptoms of AIDS can vary depending on the stage of the infection. In the early stages, there may be no noticeable symptoms. However, as the virus weakens the immune system, individuals may experience flu-like symptoms such as fever, fatigue, swollen lymph nodes, and skin rashes. As AIDS progresses, more severe symptoms can develop, including weight loss, persistent diarrhea, night sweats, and opportunistic infections. It's crucial to remember that these symptoms can also be indicative of other conditions, so it's vital to consult a healthcare professional for proper diagnosis and treatment. Section 5. Different types of arthritis and their symptoms. Arthritis encompasses a range of conditions that affect the joints. Osteoarthritis, the most common type, is characterized by the breakdown of cartilage, leading to pain and stiffness. Rheumatoid arthritis is an autoimmune disorder where the body attacks its own joints, causing inflammation, pain, and joint damage. HIV-related arthritis typically manifests as reactive arthritis, an inflammatory joint condition that develops in response to an infection elsewhere in the body. It's important to distinguish between different types of arthritis to ensure appropriate treatment and management strategies are implemented. Section 6. Treatment options for AIDS, antiretroviral therapy. While there's no cure for AIDS, antiretroviral therapy, or ART, is highly effective in managing the virus and preventing the progression to AIDS. ART has revolutionized the treatment landscape for HIV, transforming what was once a fatal diagnosis into a manageable chronic condition. ART involves taking a combination of medications that work by stopping HIV from replicating in the body. These medications target different stages of the HIV life cycle, making it harder for the virus to multiply and cause damage. This helps to protect the immune system and slow down the progression of the disease. By maintaining a lower viral load, individuals on ART can reduce the risk of transmitting the virus to others. Adhering to ART is crucial for individuals diagnosed with HIV. Consistency in taking the medication as prescribed is key to its effectiveness. Missing doses can lead to drug resistance, making the virus harder to control. By taking medications as prescribed and attending regular medical checkups, individuals with HIV can live long and healthy lives while managing the virus effectively. Regular monitoring by healthcare professionals ensures that the treatment is working and allows for adjustments if necessary. With the right care and support, people living with HIV can achieve an undetectable viral load, meaning the virus is not transmittable to others. Section 7. Managing arthritis, medications and therapies. Treating arthritis involves alleviating pain, reducing inflammation, and improving joint function. Pain relievers and anti-inflammatory medications are commonly prescribed to manage pain and inflammation. In some cases, corticosteroids may be injected into the affected joints to provide more targeted relief. Physical therapy plays a vital role in managing arthritis by improving joint flexibility, strength, and range of motion. Lifestyle modifications, such as maintaining a healthy weight, engaging in regular low-impact exercise, and protecting joints from further damage, are also essential components of arthritis management. Section 8. Preventing HIV/AIDS. Safe practices and awareness. Preventing HIV transmission involves practicing safe sex by using condoms consistently and correctly. It's crucial to get tested for HIV and other sexually transmitted infections regularly, especially if sexually active with multiple partners. Avoiding sharing needles and using sterile injecting equipment is paramount in preventing HIV transmission among people who inject drugs. Raising awareness about HIV transmission prevention methods and the importance of regular testing is crucial in reducing the spread of the virus. Section 9. Maintaining joint health tips for preventing arthritis. While not all types of arthritis are preventable, there are steps individuals can take to maintain joint health and reduce the risk of developing certain types of arthritis. Maintaining a healthy weight is crucial, as excess weight puts added stress on the joints. Engaging in regular low-impact exercise such as swimming, cycling, or walking strengthens the muscles supporting the joints and improves flexibility. Eating a balanced diet rich in fruits, vegetables, and omega-3 fatty acids can also contribute to overall